when I first started in this business, which was in 1985, I thought, well, what is it that I can teach doctors about listening well to patients and being good communicators? And the only tool that I had in my quiver, which everybody knew to recommend, was to say, ask open-ended questions. And that gets a little boring quickly. And not only that, but it's not something you want to do at any point during the interview. And after about 10 years, I realized, and 10 years of studying and teaching, I realized that, as many people have, is that there are a lot of different skills, and many of them you use all the time during the interview, but many of them are sequential. That you don't develop a plan at the beginning of the interview, and you don't ask patients what their concerns are at the end, right? So, so what's occurred is really a breakdown of skills, and in the teaching of communication skills and the studying of the process, there is, I think, a growing consensus about what those skills are. Being able to teach those major skills phases, and then the subset of skills to make those things happen, is what we try to do. And in any kind of skill learning, whether it's to be a writer or to be a snowboarder or to be a surgeon or to be a good communicator, unless you have an opportunity to get feedback that's articulate, you have an opportunity to reflect and then to try it a new way, you can't learn. And historically what we've learned is that most faculty, most medical school educators have never been taught the specific terms to describe these more refined skill sets that collectively make up doctor-patient interaction. So what we and many others have worked on is developing forms to use that help trainees categorize the skills of others that they're watching or watching themselves on video.